My name is Dr. Torabi. I'm an interventional cardiologist at Franciscan Physician Network, and I'm at the Crown Point and Munster campuses. Nutrition science is something that's always constantly evolving. At least probably the latest statement we have on caffeine and your heart health from the American Heart Association, and they're saying that, if it comes to, most people want to know, is it the coffee, right? Can they have at least one cup of coffee a day? And the American Heart Association is saying that you can at least have one. And of course, we have a lot of coffee drinkers that are probably having more than one cup a day. But no, at least from your heart, it's okay to at least have one cup. Now, the energy drinks can be a little bit of an issue, particularly with patients that have heart palpitations. And we have lots of data and papers showing that, that is going to make the palpitations worse. Now, there is no clearly published data that I've seen personally that would say that an energy drink or coffee is particularly going to make your heart valve worse. Really, when you're trying to think about what is going on with a diseased heart, it really comes down to what's the mechanism of why this is happening. Is this because of wear and tear? I mean, we have a lot of patients that they get calcium basically of their heart valve, and it's nothing to do with their diet. It's just really, you get arthritis of your knee, you can get arthritis of your valve, and you start to get wear and tear, and sometimes these valves don't want to open very well, or in other aspects that they just get way too leaky. So no real correlation with that I'm aware of with caffeine intake per se, but certainly there has been a big link with heart palpitations, and unfortunately a lot of heart valve disease can cause heart arrhythmias and heart palpitations. So in a way, they're sort of kind of indirectly related. For the patient that has a mechanical heart valve and they are going at the airport, really, these valves have very little metal in them. So you're very unlikely to essentially set off an alarm at the airport. So that should, hopefully, if anyone has one, they've been wondering, kind of rest assured that it's going to be okay. You're probably unlikely to set off the metal detector at the airport. Cabin pressure, there's been no real clinically significant reports that have come out that say that you can't go out on these flights, or you can't go, on a hike in high altitude. So that's all been sort of shown to be all right. So, I mean, same thing if you're a thrill seeker and you want to go on any roller coasters, you can go upside down. I mean, we want you to live your life. I mean, as long as you're taking the appropriate medications to basically keep these valves as healthy as possible, you're going to be all right. For the mechanical valves, that typically the trade-off of having just that one lifetime surgery is you are going to have to be on a blood thinner, because despite there being very little metal, unfortunately these can clot if you don't take your medication to help keep these leaflets of these valves nice and crisp and free of clots. So weight gain, you mean in regards to just having heart disease or just getting your valve fixed? We certainly have patients that when the valve isn't working very well, they have really bad congestive heart failure, and it's not all that uncommon for patients to not really have much of an appetite. They may not be eating very well, but what will eventually happen for patients that have really bad congestive heart failure is you probably are going to gain some weight, but for the most part, it's not from food, it's actually water weight. And the main way to tell the difference between what's water weight and what's actually from food or calories is staying on that scale. So we tell patients all the time that if you're gaining more than 2.5 pounds in a day or 5 pounds in a week, that's not food. That's water weight. That's from your heart not working very well. And that's where you need to make the appropriate adjustments to your medication to make sure that you're doing all right, and to make the right adjustments. Now, do patients, after they get their valve fixed, do they gain some weight? Well, certainly for a lot of patients, their appetite improves, and yeah, I guess if the food starts tasting better and they gain a little weight, then that's maybe a small price tag to pay to get a brand new valve. But we certainly, I think that kind of helps shift gears, because now all of a sudden the patient that really couldn't be physically active because they were so symptomatic, now they can be.